Celine is going to let us know when we're live, right?
Okay.
We're live now.
Right. Thanks everyone for being here. Bonsoir, good evening. Thank you everyone for being here with us tonight. Thank you to your families for giving us space to be here for this virtual event, which I'm so honored to host from the unceded territory of the Algonquin Anishinaabe people. They are the traditional waterkeepers of the Tebasum River, which is known to most people as the Ottawa River. I've been asked to begin this event with a land acknowledgement. And I'd like to do it a little differently than what we've seen done before or what I've done before. So rather than stating what is known and promises of commitments to uphold, I'd like to step away from my usual settler perspective. And instead, I'd like to invite us all to connect to the land on which we live and the water flowing around us. We're gathering to discuss mental health, and we will discuss policies and platforms, as well as the realities and the needs of Ontarians. But before we do that, I'd also like us to consider the relationship between mental health and Mother Earth. I grew up near the Tebasum River, and as a teenager, when I felt lost or overwhelmed, confused, anxious, taking a bike ride along the river allowed me to connect to the beauty and the resilience of nature, but it also allowed me to connect that beauty and resilience within myself. And nowadays, it's the McArthur bog here in Orléans for me. It's my favorite place to take my son for nature walks. And as a mom, when I'm feeling overwhelmed or stressed, it's a place that lets me find my footing and helps me connect with something greater than myself. So as we move towards this reflection on mental health, I'd like to invite you each to consider your own stories of connection with the land on which you find yourselves tonight. I'd like us to begin the discussion by collectively acknowledging, but also feeling our interconnectedness. We are connected to the land, to its beauty and resilience, to its wisdom and power. We're connected to one another. We are part of the same beauty and resilience, power and wisdom. And without further ado, I'd like to begin by introducing our panelists. So you'll each have a brief moment to introduce yourselves. I'd like to begin with Mike, and then we'll go around this virtual table.
Well, thanks, Michelle. And I think most people know me as the MPP for Guelph and the leader of the Ontario Green Party, but I'm also a husband, father, son, and I'm speaking to you from the treaty lands of the Mississaugas of the Credit First Nation. And I'm I'm at my home in Guelph on the banks of the Speed River. And that's where I find a lot of my connection to nature.
Thanks, Mike. I'm just going to go down around the virtual table on my screen. So Michelle, if you could go next.
Yes, I am Michelle McArthur. I am an occupational therapist. And for those who don't know what an occupational therapist is we look at the activities that really make us us. So the meaningful activities that you do every day, the things that you want to do, you need to do, you have to do, everything that you do in a daily everything that you do daily, and that's what makes you you. So mental health is something that I am very passionate about because that often impacts who we are. And so I'm really excited to be here today.
Thanks, Michelle. Next, we have Tebasum.
Hi, everybody. Thanks very much for having me. My name is Tebasum Durrani. I'm a lawyer and I work with Legal Aid Ontario. Currently, I help injured workers navigate the workers' compensation system. And I've previously done employment and human rights law and worked in housing and social assistance. So different areas of practice where I work very closely with people who are low-income Ontarians, newcomers to our province. And so I bring kind of an intersectional approach to issues of poverty and law. And of course, mental health sits really at the center of that type of connection. So I'm very much looking forward to sharing some of those reflections with all of you tonight.
That's great, thank you. And last we have Renee.
Hello, hello. I'm Renee Ouimet. I'm a retired social worker, but still active in doing education and training in the mental health field, especially in the mental health in the workplace field. I hate to tell you how many years I've been involved in community mental health, over 35 years. And, you know, the one thing that struck me as I was thinking about and preparing for this tonight is, you know, I know we have a long way to go. We've come a long, long way. My first job when I finished my master's degree was in a psych hospital, not in Ontario, in another province. But if you ever saw the famous film of One Flew Over the Cuckoo's Nest, that's where I worked. So, you know, every time I get discouraged about how our system is working now, I think back of where we've come from. And we've come a long way. We've got a long way to go still. But, you know, when you think of it, in those days, community mental health didn't exist. Peer support didn't exist. And so, yeah, I come here with lots of thoughts about what's working well, I think, and what we still need to work on.
Thank you, Renee. Just hearing each of your introductions, I'm looking forward to the discussion because it seems like there's a really great diversity of backgrounds and experiences. So I think the discussion will be really rich. We're going to start the go around with a pretty simple question, but one that feels pretty loaded at the same time to me. It's quite simply, what does mental health mean to you? So to situate our audience in the structure of the event, you'll each have a brief moment to give your initial thoughts, and then we'll go into an open discussion amongst all the panelists. And we'll do a bit of rotation. So each person will get a chance to start and then be second, third, and fourth, just to make things absolutely fair for us all. So to begin the discussion, I'll go towards you, Mike. What does mental health mean to you?
Yeah, well, I mean, for me, mental health is health. And I think that's one of the big challenges we're facing, is to overcome the stigma associated with mental health and addictions. And I have so many people come to my constituency office desperate to access affordable mental health services, and especially parents. And so we'll probably have some time to talk about some of the statistics around wait times for youth to access mental health care. But the heartbreaking stories that people share with me, and I think, you know, if you're facing cancer or broken arm or needed heart bypass surgery or whatever, you just wanted to have the levels of stigma and wait times associated with physical health that you have for mental health. And I'm going to tell a story tonight that I've never told publicly, but I have permission from my daughter to tell this story. When those parents come to my office, it's very personal for me. I had a daughter who had a very severe eating disorder. And as a parent, it's just so overwhelming and hard, because you're both desperate to find help for your child. Severe eating disorder can be a very life-threatening situation. And you're at the same time just beating yourself up as a parent. Like, what did you do wrong? You know, and I think of how hard my wife and I struggled to convince healthcare practitioners that my daughter needed help, and she needed help now, and that our family needed help, and we needed help now. And my wife and I are both very privileged people. And so, you know, we were able to advocate, and we advocated until we got the help and support we needed. And now my, you know, daughter's a thriving, just graduated from university in psychology and wants to give back as part of her own mental health recovery journey. But I don't want any family to go through what our family's gone through in terms of fighting for access to mental health supports, and especially families who aren't as privileged as our family is. And so I think it's, as we push for and advocate for a mental health system that really serves people and centers people's well-being, it's very personal for me.
Thank you, Mike. Next, Michelle, if you'd like to take the lead on what mental health means for you.
Sure. So in my profession, I often see how mental health affects everything in one's life. And it's such a negative cycle. So starting with self-care. So, you'll see people who are having a hard time even doing bathing or taking care of themselves, how it affects their home. And so you'll start seeing things get a bit messier because it's hard to be able to stay on top of those things when you're dealing with such issues within yourself. And then it affects parenting and how you're able to interact with your children, and then your relationship, whether it be your support partner or your friendships, and how those break down. And what you see is this really unfortunate negative cycle that starts happening where things start to crumble, and then their mental health becomes even worse. And then it just creates this really unfortunate result. And what's going on in our mental health system right now is that our status quo our standard is so low for where we're hoping that people are. It's very reactionary. We're not preventing this from happening. We're just trying to kind of get people, okay, you're okay because at least, you don't have maybe suicidal ideation. So you're fine. And they kind of get shuffled off to the side. So I see this so often in my clients where I can't, even myself as somebody who's very educated and who's a big advocate, is having a hard time accessing resources for them. So I see it certainly in my professional life, but then I also see it with moms that I know that can't get their kids help, that can't get themselves help. I see it in my siblings, in my family, and it's so difficult to say, okay, but just hold on. It's going to be 2 years until you get access, but just hold on for a little bit longer. It's just so difficult to be able to say that when they're already drowning. So I'm really excited about this conversation we're having, because we really do need to start speeding up this process so that we're being more preventative as opposed to reactionary. So that's what mental health means to me. It's my whole world, a lot of it. So I'm hoping to advocate for those who are really struggling right now.
Thanks, Michelle. I appreciate the perspective. And Tebasum, would you like to go next?
Sure. Thanks, Michelle. I echo what Mike said at the outset, that for me, mental health is health, and I don't think we can talk about health without understanding that your mental well-being is inextricably tied to your physical well-being, and we still silo the two. I think in my world, similar to what Michelle, you were talking about, how you see clients who are and the reverberating impacts of mental health in their lives. I see that too with injured workers who have suffered a really debilitating physical injury, can't return to their job, and see their life sort of crumble because of that. They lose family connections, and they develop mental health issues, or an injury can exacerbate maybe a pre-existing issue. So it really has it's so all-encompassing. And I think why this conversation is so important is understanding where and how people can access the supports where they're at. And what I mean by that is the way that I would access mental health support is very different from a client that I represent, or somebody in it with a different experience. For me, of particular interest are people who are newcomers to our province, people who are just trying to navigate systems that are unfamiliar for different reasons, language barriers, cultural barriers. So to me, when I think about systems and how we can make them accessible and equitable, I like to think about it from that perspective. So looking forward to hearing people's thoughts on that tonight as well.
Thank you. And next, Renee.
Well, it's interesting because, I look at mental health very much in the same way, that it is part of health. And it's taken so long, and I think it's still there, that we still think of it as an absence of mental illness. And that's not the case at all. It's really our way of trying to cope with life, with stressors, with work, productivity, etc., which is real hard right now, right? And we've seen an incredible amount of anxiety and stress because of the pandemic. But I'm going to put them, well, I don't know what the word would be. It's not positive. It's not a benefit. But, I think, and it's sad, but so many people now know what it's like to be anxious and to be stressed out and have experienced it, have sought help, hopefully, that's going to encourage us to destigmatize, to lower stigma, and to say that, what, we all have mental health issues, all of us here, in some shape or form, right? We're on a spectrum. There are days where we're doing beautifully and other days where we just want to, oh my gosh, please, right? And we've had lots of days, but so I guess maybe it's my optimism that this has opened up dialogue around talking about mental health that we wouldn't have done in the past, and may then really start looking at at services, what we need, what we have, etc. So I'm putting a hopeful note to it.
Thank you, Renee, for putting that positive spin on it. I can relate, because as someone who has worked as a registered psychotherapist and who's worked in social services, I find that because I have, people will come to me with questions because the door is open. So there's something there. But I think more and more people are accessing the services, and it's normalizing that it's as okay to see a therapist as it is to go see a dentist. If we could get there, that would be fantastic, or a doctor.
Yes.
Yeah.
I'd like to open the floor to all of us now to just further discuss what mental health means. We have about 4 or 5 minutes to chat about it. Is there more you'd like to add?
Well, I'll just add that I really liked the discussion as sort of talked about accessing services, but also prevention. And I think, all of us have talked about the connection to nature, the connection to people. How do we deal with isolation and loneliness? How do we deal with issues of, poverty and lack of access to adequate housing? I mean, the existential climate crisis, there's so many, the pandemic, there's so many things in our lives that we have to deal with and we have to address. And I think the more that we can connect people to each other and to nature and to a hopeful future, and address basic needs such as housing and economic security, etc., the better we'll have mental well-being. And sometimes I think that part of the discussion around mental health sometimes isn't part of the discussion. Just how do you create good mental well-being to prevent people from being in more acute or crisis states?
I also think what I heard from everybody is there's so many areas where we can kind of sprinkle coping strategies or mental health advocacy, and to be able to talk about it more. So it's more of a widespread, as Renee was saying, and I appreciate this, is that, we've come a far way. It used to be that mental health was way over here. Don't touch us. It's over there. We don't want to hear about it. And now what we're hearing is it really is affecting all of us. So how can we kind of sprinkle in mental health assistance everywhere so that everybody feels like they can get support from wherever they're at whatever stage of life they're at. And so I think what I'm hearing from everybody is there's room for mental health education everywhere.
Yeah, and I would just pick up on that and say something I think about is where that fits into our education system, and ensuring that, I mean, if I look back, I don't think that mental health was a component of our health classes. If I don't remember, but I'm pretty sure it wasn't, and it wasn't something that it wasn't part of my experience. We talked about physical health and all of those things, and we had to do physical tests in gym class to sort of measure our physical capacity and endurance, and that's all good and promoting healthy lifestyles. But I think I never was exposed to that until later in my life. And I wonder, and I hope that younger people, if we expose them to those conversations in a supportive environment, maybe that goes some ways to what we're talking about tonight, which is preventative as well.
Yeah, we should be really starting in kindergarten, shouldn't we? you know, and no, and it's absolutely, and I think there are some programs now, but we sure need to have more and focused, as you say, you know, on children to start with, right, and to build that. Their self-esteem, their network of supports. You know, I think we're doing things around bullying, etc. But I think we have to go beyond that as an example. Yeah, you're right. We probably haven't focused on. We're focusing more, I think, on prevention. But we've, as you said, Michelle, we've focused a lot on services and mental illness, right? Without looking at prevention and the way Mike is talking about holistically. Yeah, that means, you know, your physical health, your mental health, you know, your support system, your family, your work, etc., income. I mean, it all, it's complex.
It's very complex.
Yeah.
I think it's interesting because you're all touching upon the things that we need to change, and that leads us perfectly into our next question, which is just about that. The next question is around what tangible changes need to be made to expand the mental health care provided in the province. Are there things that can be done, such as, you know, licensed psychotherapists and social workers being funded under OHIP? Do you have any other ideas? And this time we're going to start with Michelle for the first go around.
So, I mean, I have so many ideas, but I'm going to try to keep them manageable. So I again will advocate for activities. I mean, that's my perspective as an occupational therapist of how meaningful activities can really contribute to someone's mental well-being. So one thing I've noticed is there's not a lot of free group support or less expensive group support where somebody can, let's say, go in and try a new leisure activity, try woodworking, try cooking, try life skills, creating more courses for employability. There's lots of online ones, but I would love to be able to see these programs where somebody could go in and meet other people. I feel like, especially with coming out of the pandemic, there's been a lot of isolation, and I have a lot of clients who are really wanting to meet people, but it's very difficult to find something that is reasonably with a reasonable cost. So having more programs that are in community centers, having more programs that are in small cities. I mean, certainly I can find some in the larger cities around me, but what about those who don't have access to a car, who can't get there as easily? So I would really love to see more community programs. And then the other point I kind of wanted to touch on is mobile apps. So I have seen a few healthcare apps such as Ability CBT and Bounce Back, which has been it's a great idea. I love the fact that this has been something that family physicians can refer to. It has kind of helped with at least providing some services to those who can't access it or are on the wait list for somebody such as a social worker or a psychiatrist, but they're both based on the same treatment. And I would love to see other types of treatments that are delivered through applications, mobile applications that are culturally relevant or relevant to certain diagnoses, so that it's not just a one size fits all, because I think that way, at least those who might not have the ability to go one-on-one, or like I said, are on the wait list, it just at least provides a little bit of a cushion while we're trying to figure out the best route for each client. So those are my 2 points. I could probably go on, but I'll pass it. I'll pass it over.
Go on for a long time. You have lots of ideas. Next, we'll go to Tebasum.
Yeah, I think that the other folks around the table probably have probably more pertinent direct experience with this question, but I think just generally, I think that there's obviously a whole host of practitioners that aren't covered through OHIP, people like community caseworkers and other addictions counselors and other people who I think I read a quote recently where somebody described them as sort of the glue that connects medical practitioners with other community-based supports for people. And so, I mean, the actual nuts and bolts of how to do this, I'm not so sure, but finding a way to, bring those people into the treatment fold and make and allow people to connect to them much more easily than they can now. And I mean, just from my perspective, some possible ways of doing that are to enhancing the ability of primary care physicians to be a better kind of referral resource for people. I know in my experience dealing with clients, oftentimes they might not have their relationship with their family doctor is often one that's pretty long-standing, and in many cases it's somebody that they have formed a trusting relationship with, and so that person often ends up kind of providing supportive counseling, even though they're just a primary care physician. But that plays an important role, and also they can also be incentivized and supported in providing more targeted referrals. And also I think I see a role for physician assistants potentially to perhaps create physician assistants who specialize in psychiatric or psychological care that can help address backlog issues and capacity issues.
Thank you, Tebasum. Renee, would you like to add?
Well, I agree with everything that people have been saying, in the sense that it would be wonderful to be able to integrate certain professions much more and working in teams, right? And I did work for an organization where the teams were very, very variable. It wasn't only one profession, and also peer support. I think peer support is key. And I used to supervise a program, and that was an immense, wonderful thing to add to a community mental health service, with people who are trained peer supporters, who have so many different things or skills and strengths to be able, and what's helped them to be able to share and support others and towards that journey. So I'd like to see definitely more of that, but I think we really we have some very good models of community mental health services in this province. We have many cities that have very good ones, but we need more, right? If I think of outreach, of community support, services of housing first being intertwined, we need to really look at the development of more affordable housing and neighborhoods, right? I have met one person in my lifetime with mental illness who wasn't foreseeing that, my gosh, wouldn't it be nice to have my own apartment and enough income to be able to live on, to find a job and live a life, right? So we need to really look and integrate all those elements that really make up mental health, right? For all of us. So I'd increase, definitely agree with what you're saying around apps and more services. But I also think we have some very good models already in existence that are begging for more funds and just can't, community mental health agencies, at least in my region, I mean, they were overwhelmed. The staff are exhausted. I know, because I chat with them, and we need more.
Thanks, Renee. It's interesting how already the connections that everyone's making in their own fields and their own perspective, it's what comes up a lot for me, is this idea of everything is interconnected. So what would you like to add, Mike?
I think Renee set me up perfectly for what I want to say. Partly, I've been talking about this all day today with the release of our mental health strategy, More Caring Ontario, and we're advocating for an 8% base budget increase for those community mental health organizations, and they desperately need them. I can't tell you how many organizations I've talked to who, they know people need help. They want to provide more help, like such dedicated and caring and highly qualified practitioners, and they're just overwhelmed. Like there just isn't enough people to provide the services to meet the demands. And then likewise, just advocating for more expanded services available through OHIP. increasingly, I think I opened this with mental health is health, and we're increasingly hearing more and more people say that, but then we have to fund it like we do the healthcare system and actually make it available, affordable, and accessible for people. Because even, I meet people who, even when they are able to access mental health supports, they're oftentimes unable to afford them, or they might be able to afford a month or two's worth of therapy, and then that's it. And that's not enough. And so having that available, having more practitioners available and more service providers available through OHIP, and integrating it with, family health teams and nurse practitioner-led clinics and primary health care, all of that I think is just vital. And so we've been advocating for basically a 4-year, $6.5 billion increase in funding to the sector, which I think is just absolutely needed. In raising the amount of money we spend on mental health to 10% of our healthcare budget, which really would put Ontario more in line with OECD countries in terms of the percentage they spend, as well as the fact that, the Canadian Mental Health Association has indicated that 10% of the disease burden in Ontario is related to mental health issues, but only 7% of the funding goes there. And so, that alone just is an indication of the funding gaps that exist. And I would argue, and I would say this to my friends who worry about fiscal responsibility, that spending the money, particularly with early intervention and especially addressing things like childhood trauma as early as possible, that we will save so much money in other areas, the criminal justice system, the social services, healthcare, but more importantly, we'll just create a higher quality of life for people.
Thank you, Mike. I feel like cheering. I relate so much to my experience. I worked for a number of years for a sexual assault support center. And it was exactly what I was seeing for women who were survivors of childhood trauma, just it coming up later in life, that had it been supported early on in life, so much could have been prevented. So unfortunately, you all had such great ideas on all that we can change and improve that we're going to skip the discussion amongst you and go straight to the next question. The next question is about substance abuse. So we've seen that the pandemic has exacerbated substance use issues for many people across the province, and it's clear that we need a comprehensive plan. So how can Ontario better support people with substance use challenges? And do we, it's funny that I'm saying this, do we need to start rethinking our current systems? I think we're already touching upon that, so we'll just continue along those lines. So this time we'll begin with you, Tebasum.
I think this is a very pressing issue. And I think that in terms of how we can better support people, I think that starts with better access to information and data about things like overdose to inform the public discourse around the issue. I think that that's a really important foundational principle. And then I think another aspect is, in my mind, is also, again, finding ways to support primary care physicians who are typically the ones or typically involved in providing care for patients with chronic pain, and also finding ways to improve coordination of care between physicians and addiction services. And I think on this point, I wanted to just briefly touch on two things in the workers' comp context specifically, because I work at a legal clinic that advocates for injured workers, and we've recently done some work around how policies from the WSIB actually have the unintended consequence of pushing workers to use opioids, and sometimes create an unhealthy dependency on opioids. And part of that stems from structural policies that try to push workers back to work prematurely under the guise that they're better at work, when treating doctors and other therapists don't recommend a return to work yet. And so oftentimes, to prevent being cut off from their benefits because they're not cooperating and return to work, workers turn to opioids to manage pain, just to do what they're supposed to do. And there has been some media coverage of that. So that's an example of, I think, something that's an example of a structural change within one system that has really significant impact. Another part of that, but I think it stretches beyond the workers' comp system, is the lack of availability of other alternative treatments. So for injured workers, it can be difficult to get access to physiotherapy covered through the workers' compensation system. They can sometimes, it's not often for as much as they need it for, and it can be a battle to get additional treatment. The same goes for medical cannabis. It can be very difficult to get that approved under the WSIB's policies around approving healthcare. And so all that to say, I think that in my little corner of the world, we see these issues where there are alternative treatments and options available to workers that we should be looking at. And yet some of the structural policies that workers are coming up against prevent them from doing it, which fuels some of the problems that we're seeing.
Thank you, Tebasum. Really insightful to just hear about that whole cycle that's happening there. Next, Renee, what are your thoughts on this issue of how we can better support people with?
Well, I think both those systems, the addictions and mental health system, have started working together, but they really need to be, to me, integrated. You can't separate them. And, if you look at, for instance, models like, working around concurrent disorders, which I think has been very successful. There's been some very good treatment there. And that needs to be, here we go again, expanded. So, I think, as you were saying earlier, we've been working a lot in silos, but less so. And we need to continue narrowing that silo and really looking at what each sector can do together and how they intertwine, very much so. So I agree. There's a growing need for definitely around opiates. I know I've been talking to colleagues and in this region saying it's just an epidemic nature at this point, and that again, how do we deal with that? And not easy. And again, you can't separate it from homelessness, poverty. It's yeah.
Next, Mike, what would you like to add?
Yeah, I think what you've been touching on is just reframing substance use addictions as a health issue. I think all too often it's seen as a criminal justice issue, or rather than a health issue. And so reframing that conversation and really putting more resources behind expanding treatment options for people, but also harm reduction options for folks. Looking at things like best practices in other jurisdictions. So we've seen decriminalization of drugs, for instance, in places like Portugal, lead to less harm for people. Which isn't the same. Some people start saying, "Oh, you're going to make every drug legal." No, decriminalization is a different approach. And I also think looking at things like how we respond to crisis, like people in crisis, and having more of a mental health approach and less of a policing approach, I think will go a long way towards improving outcomes.
And a failure approach, I think. Right?
Yeah, avoiding the failure approach. Yes.
Yeah. Yeah.
And next, Michelle, would you like to add anything?
Yes. So I often see substance use as a symptom of a greater person. So what I often see, a lot of my patients or clients are also dealing with possible cognitive issues as well as physical issues. And so one of the things that I've been struggling with, even to find housing or programs that are physically accessible to many of my clients who have mobility issues. And many of the housing and the programs are often within their triggering environments. So creating more programs that are within the community so that not only can they get away from the environment that triggers them in the first place and their support group that also doesn't help their recovery. So getting them and helping them get back to the community as a wider community. I actually have one gentleman that I'm working with that he has a history of substance use as well as a criminal background. And even just getting, I'm finding it hard to find him groups to socialize with people outside of his support network. He can't even volunteer most places because he has a criminal background. So trying to get somebody away from that environment is even really difficult in our system right now. So absolutely what Renee is saying, like we need to just expand. We need more resources. We need more programs. We need to have them dispersed along the environment. So that's what I would be advocating for.
Thank you, Michelle. Once again, we don't have time for the open discussion, but I'm just finding it so rich to listen to each of you that I don't dare interrupt the flow of the conversation. So I hope you don't mind. I just want to give you each space to share your ideas. So the next question is around all these connections that we've been talking about. I see everyone, talking with their hands and making different connections in their different fields. This time we'll start with you, Renee. What would you say is the connection between mental health and things like affordable housing, universal basic income, affordable childcare, nature trails, community centers, all these other things that we've mentioned, I think, in every question since the beginning?
Well, I think if we have all of these elements, then it increases our mental health and helps us stay mentally healthy, right? And, we know that we need, at least in my region, again, we need more affordable housing. We need more scattered housing and sites and neighborhoods again, right? Where people can live on their own, but with support. So I think that they're all connected in the sense of if people are feeling that my gosh, I have housing that is safe. I can find childcare that I feel good about. And hopefully I can live in a neighborhood, as Mike was saying, that where I can walk around, be in nature, take care of my physical as well as my mental health. So I think you can't talk about one without connecting it to the other. It's just impossible. So yeah.
Thanks, Penny. Mike, you would be next for this question.
Yeah, I just think we absolutely have to address both the social and environmental determinants of health. I mean, let's face it, poverty is the number one indicator, but both physical and mental health.
Yeah.
Frankly, access to housing, access to affordable housing and permanent supportive housing that wrap around mental health and other supports, particularly for people who are facing chronic homelessness and or addictions challenges. Ensuring community connections and living in communities where we have places and spaces to connect and break down isolation and loneliness, where we can have access to parks and nature and trails. And I can't not be the leader of the Green Party and just sort of talk about how many young people in particular who talk about like hope for the future and what the climate crisis and just the kind of world that we're leaving young people, and making sure that we leave, or that we work towards a livable future to provide especially young people with hope for the future, and how important that's connected to people's mental wellness as well. And so I think all those connections in our communities, with each other, with nature, and ensuring that people have their basic economic security, housing, food needs met.
Thanks, Mike. Michelle, how would you like to take on this question?
Certainly echo everyone else. I mean, everything's connected, and having more housing available, resources available. I also want to speak to the simplicity of the access. So right now, in order to apply for housing, it's like some of the cities have pages of forms in order to be able to fill out. And then some places you email, some places you mail, some places you fax. It's not streamlined, and it's very difficult for quite a few of my clients to be able to fill in. And most of my clients are English speaking. I can't imagine what it would be like if English was a second language. So I would love to see some of these, housing, finding any kind of like income, all of these to be streamlined, so there's not so much paperwork involved. That is all.
Thank you. Tebasum, would you like to add more ideas to this?
I'd certainly echo what's been said, and just reiterate that I think people with mental health illnesses face a range of barriers, including stigma and discrimination, and things like trying to get housing in the first place, and in their employment, in their jobs. And I think everybody has touched on a really key point, that it's all very interconnected. And I agree that processes can be really complicated, and often people have to intersect with so many at the same time. You might be trying to get on like the Toronto community housing waiting list. You may be trying to apply for Ontario disability support. Maybe you're trying to get workers' comp, and you're also trying to navigate a refugee application. So, I mean, if that's complicated for somebody that may or may not have a mental health issue on top of all of that. But when you do, I think it just makes that all the more difficult to navigate. And it makes me think about the idea that not only is it important to make sure that things like housing and these programs are available to people, but also the tools to help them navigate and then maintain those things. So it's one thing to say that we need to increase investment in supportive housing, which is really important. But then it's also the services you provide to make sure that people maintain that and keep that. And I think, to me, it's a big part of the conversation. And yes, I echo Michelle's point. I mean, these systems are doubly difficult for people that don't speak English, or are new to our cities and communities. And it's just it's all the more reason for us to make sure that we are any conversation that we have about anything is rooted in thinking about how somebody that may not have our privileges or our reference point would navigate those things.
Thank you, Tebasum. I think that adds a lot of interesting points to the discussion. I'm impressed because we're already wrapping up and heading towards the end of this hour together. And I'd like to give you each a little bit of space to close with your final thoughts or takeaways for our discussion. So for this part, I'll go back to you, Mike, to start off with some closing remarks.
Yeah, I think one of the things that for me is to really ask ourselves what kind of Ontario we want to create. And for me, I want to live in a green, more caring Ontario. And sometimes that takes investments. And so, one of the things that I'm really pushing for at Queen's Park right now is for us to make the investments in, building 160,000 affordable housing spaces with 60,000 permanent supportive spaces with, mental health and addiction supports, to increase the base budgets for those community mental health organizations that are doing such wonderful work to help people, to reduce the wait times, especially for children, to access mental health supports, and to create those community connections through things like youth wellness hubs, to make sure that mental health services are affordable and accessible and comprehensive for people, and that more of those services are available under OHIP, so it's really truly affordable and easy to navigate for people. And I guess those are the choices we make and the kind of things that we want to invest in. And so, not to get too political here, but when the government says, hey, we'll give you $120 off your license plate sticker, and that adds up to $1.1 billion. Well, I think that's $1.1 billion that we can invest in creating better communities and improving people's mental health and well-being, and ensuring that people have access to supports and services. And I guess that's just the kind of Ontario I want to live in, that makes those kinds of investments in people and community.
Thank you, Mike. Michelle, what are your closing thoughts?
I certainly have enjoyed this conversation today. And I think what I'd really like to see, and to your point, Mike, of what kind of Ontario I want to see mental health as something that is educated in many different formats, is easy to be able to, there's lots of resources out there that we can access. And kind of to the point that Tebasum had made it at the very beginning of that education component when we're kids and we're teens. Like, I know how to kind of eat healthy, and I know that exercise is really good for my body, but did I intuitively know how to cope with stress and anxiety and depression? Absolutely not, coming out of high school. So I'd love these conversations to be able to be something that everyone has, and we all have at least some sort of coping strategies. And so hopefully that preventative shift in that perspective will help us down the line and save us more money down the line, because we have some ideas of how to kind of give ourselves self-care.
Thank you, Michelle. Tebasum, you're next. What are your final thoughts and takeaways?
I think the biggest takeaway for me is just the overriding theme of it, of how everything is so interconnected, and I'm struck by just how important an investment this is. I agree for future generations, but I also just think about what's going on in the world around us and what a difference it would make if we could, if we focused on how, on how people relate to one another. And I think that's such a big part of what mental health is about ultimately, is just your relationship with yourself and with other people and with your community. And so not only, of course, do I come at this from the perspective of the clients that I work with on a regular basis, but I just, after today, I'm thinking about it on a much bigger level, that this kind of investment doesn't just matter for the very practical and important issues we're talking about, but also I think on a much bigger scale, that if we're a healthier society, both mentally and physically, I think that will have an impact on relations between people, between communities, between countries. Maybe I'm just going out into the abyss here a bit. But, anyways, yeah, those are my concluding thoughts.
Thank you, Tebasum. And Renee, what about you? Takeaways and final thoughts?
Well, I think I feel encouraged that we've had this conversation, because I'm thinking that probably even 10 years ago, we wouldn't have been talking about mental health like this and openly, and talking about, having less stigma, that people will feel more comfortable about their mental health being part of their health and getting support and what's needed, and with all the elements we've been talking about of our basic physical needs, emotional needs, relationship needs. And we need to continue this, and to continue this dialogue and looking at, the systems that work and multiplying them.
Thank you, Renee. In closing, I'd like to thank all of you for sharing. It's really inspiring. Like, I'm coming out of this smiling and radiating, and it fills me with hope. And I think it's especially important at this time in history, after 2 years of a long pandemic, and as we're currently witnessing what's happening in Ukraine and Russia. I really feel like people need hope right now. Young people need hope as we're facing the climate crisis. So thank you each for your contribution and openness. When we were planning this event, we had another panelist who was supposed to join us, named Taylor Shacknow, and she committed to contribute to our discussion, but she notified us earlier this week that she couldn't make it because she had to attend to her own mental health, actually. Taylor is a passionate mental health advocate, enhancing the dialogue surrounding mental health and working to end stigma and increase accessible services, all things we've talked about tonight. So although we're disappointed she couldn't make it, we thought it would be great to conclude the discussion with her remarks that she shared with us ahead of time. So this is what Taylor had to say, that I'll quote here. I was hoping to be able to show up for this roundtable discussion, and I'm grateful for the opportunity. I've been struggling with some pretty dark depression. I have to listen to my brain and body. Self-care is putting myself first and saying, I can't. Just because I'm a mental health advocate, it doesn't mean I'm always able to advocate. I appreciate you listening to my perspective. Mental illness is an epidemic, which is getting worse every day. There are enormous gaps in the system, especially for marginalized people. This is a huge problem which has majorly escalated the last few years. I've been in and out of the mental health system, excuse me, for the last 10 years of my life. At times I was treated like garbage by health professionals. I've had some terrible experiences, and sometimes I got what I needed. Nonetheless, I am lucky because I got access to treatment and have had support, but it has never been easy. What we direly need is more free and/or affordable services and treatment. We need less waiting lists. We need to provide mental health education for professionals. We need funding. We need people in power to fight for more funding, for more services. We need the government to provide more funding. We need to stop criminalizing mental illness. I say we need because mental illness is fatal and progressive, and we need to do better right now. We need to take it more seriously. We need to treat mental disability exactly how we treat physical disability. We need change, otherwise suicide rates and overdose deaths will continue to rise every day. We provide treatment to people who have heart disease, diabetes, lung diseases, broken bones, etc. We need people with mental illness to receive the same treatment. I hope we can make change starting today. Thank you. Thank you, Taylor, for sharing those thoughts with us. And I'd also like to take a moment to send some love and support to Taylor. In fact, I think we all know someone who's struggling with mental health challenges, especially after these 2 years of pandemic.
Yep.
And I think throughout our lives, each of us has gone through moments of darkness and distress. So let us take a moment to remember that interconnectedness. It's been like the theme of the whole conversation tonight. So as we did in the beginning, to connect to that beauty and resilience, to the wisdom and power that's within us and that's all around us. And may that be the foundation for us building healthy, vibrant communities together. Thank you so much for being with us tonight. Thank you to our panelists and for everyone who tuned in to speak about mental health. We certainly need it.
Thank you, Michelle.
Yes, thank you very much.
Michelle. Be well, everyone.
Take care.
Be safe.
Bye-bye.